Today we are back at the HEKIMA Podcast, where we are all focused on mental health research for the public. And what brings us today from the last conversation we had, which was really to understand why do we need to have mental health research data. Today we want to know why do we need people with lived experiences being involved in traditional research. So all the times that research has been made within our settings is that someone sits in an office, writes a proposal, sends it, gets a grant, gets to the field, finds patients who have the mental illness, and then gives them a token. Either it's a transport refund, food, or sometimes actually even they don't give them anything. That's the irony. And then they come back and write papers and publish. And for them, their name goes up high, and then the patient is left out. So we are now going to talk about, from the perspective of someone who has had the lived experiences, why is it important to have them on board from the set point of, if we are writing a proposal, the person with the lived experience should be there. If they are applying for a grant, the person with the lived experience should be there. If we are providing care, we should listen to them more, okay? So today it's what the conversation will be about. Of course, I'm Raymond Mugume. I'm a psychiatrist. But on this podcast, I'm the moderator. And I don't usually sit alone. So today, again, I have very good colleagues. I now call them colleagues. Because of one reason or the other, which I will tell you someday. Rita and Wilber, welcome to HEKIMA Podcast.
Thank you so much.
Thank you for having
Please, who wants to go first in introducing themselves?
I think Wilber, because he's a new guest.
Oh, yeah.
I've been here before, so...
Yeah. Wilber.
Am I being bullied?
No, we are not bullying you. We're not bullying
Anyways, I'll go first. My name is Wilber Ssembajjwe. I am a biostatistician by profession. I am the co-PI or co-lead on this project of digitizing psychosis care in Uganda. Most of my work is done in Entebbe at the Medical Research Council, Uganda Virus Research Institute, and London School of Hygiene and Tropical Medicine.
You're scooping money here and there.
Money is not there. So
yes.
In short, I think that's basically who I am.
Are you married?
I'm also a husband to one wife.
Oh, okay.
Still happily married.
Hey,
And
okay.
hope to keep happily married for the rest of
That's very good. That's very good.
Thank you.
Rita?
Wilber, why didn't you add? Are you married?
I think
Myself? To be continued. To be continued, yeah.
Hi, my name is Auma Rita. I am a lawyer by profession. I am an author of 2 books, Dear Me and Dear Us. I am the founder and head of Heart to Heart Spaces.
You didn't bring your books to today. We thought we'd see your books at least. You keep telling us books,
You never
books.
buy.
We need to first see them.
Yeah, I am the founder of Heart to Heart Spaces. It's a mental health advocacy organization. We do research, we do outreaches, advocacy, and basically teach people about mental health. But also we give people referrals to see psychiatrists and psychologists.
Yes.
Yeah, and I am a person with lived experience consultant on a project called Digitizing Psychosis. Yeah, and this is my boss.
Oh,
Yeah,
I
so
thought he
today
was
I'm
your
going to
colleague.
be
we're all colleagues.
Your colleagues,
She
I
pays, I
think.
pay.
May I'll be now a fellow on this one, but again, it's good to have you. What is your highlight for the day today?
I think when I came here, I said I had a very late night, and you asked what I was doing. I love football, and I love watching football.
Okay.
So I was a witness when Arsenal was beating Bayern.
Oh, hey, already?
Yeah. And I think
Rita, the way you're shaking your head, it's as if you also you watched that.
No, I didn't watch it, but I support Arsenal.
So for you, you always come the next day to see who beat the other.
Well, she goes on who scored to get
Who
the
scored?
scores.
Who scored the other? Yes.
Yeah. My highlight, or glimmer, like I usually love to call them, is being here with you guys and talking about mental health. It just always makes me excited.
You've brought a new churungo, a new ingredient into the soup.
Yeah.
Since we really started to interact with you, I must acknowledge. It's a new churungo. Maybe it will take us a long way in understanding the mental health research for the public. So, Rita, what first made you want to get involved in research in the first place, given that on this panel, you're the one who has a lived experience with mental illness? What prompted you? What provoked you?
So, as a person with lived experience, I got my diagnosis at a point where it was already chronic. So now they were just trying to catch up and find solutions at that stage.
What kind of solutions?
The medication, the therapy, what will work for you, what won't work for you. Are you going to be on this for a long time? Is it going to be short term?
Yeah.
And I remember thinking to myself, if I had known about mental health or mental illness earlier, I most definitely would have come in earlier.
Do you think you would have been vocal?
Yeah, I think I would
Earlier?
have been, yes.
I think Rita, I know, is quite vocal, so she doesn't know
That's why I'm
about
asking
anything.
the question, yeah.
I think I would have been vocal earlier, but then as I kept going on my journey to healing, I saw how much preventative measures are more important. So that's what got me
And more so when they come
interested
early.
in research. If we can, the researchers are able to get this data and we read about it and we get all this information and we're able to educate people and people know. So we are now handling mental health from a preventative point of view.
Yeah, prevention is way better than cure. I agree.
As opposed to the other side of it, where
Of
we're just
bombard medication,
yeah.
admit, restrain.
Yeah, so that made me very passionate about wanting to be involved in the research process.
So that brings me to Wilber. Why do you think we should have lived experience in our traditional research? You've been a statistician quite longer, right? I know you also helped me to analyze my data when I didn't know what those...
I hope you passed, excelled.
I excelled. I am looking forward to graduation soon.
Okay.
But why do you think we should have people with lived experiences now getting involved in research, given that you're a co-PI?
So I'll give you a backstory to this. Much of my work earlier on was in HIV. And you all know HIV has had a lot of advocacy and
funding. You say funding.
And funding.
You say funding.
So there's a project we did in the rural areas of many rural areas in Uganda, and
as usually
many times we would go and interact with people that are living with HIV, but they would not relate. They were thinking, we have money, we've come to get their samples.
And the money, yes.
Take them to the Bazungu, and that's it.
And that's it.
Then on the project, we got a lady who was open to come out and speak about her living with HIV. And we realized it's bringing us closer to the communities. So
like you felt you were connecting with the community?
The communities felt they were getting us
the communities,
because
okay.
Part of our team is someone that can relate with them.
We can relate, okay.
And can openly talk about it.
So you found this lady in the community when you were doing the project?
Yeah, we got her from one of the referral hospitals, and we got her story, and she was willing to open up
share.
Because also the communities knew her where we're going. And
okay.
So she was like a bridging gap between the researcher and the communities. So from then, we didn't take it as something really serious.
Okay.
Until the very recent past where...
our recent past.
Give
us some context. Context.
So
1 year, 2 years back.
After HIV, I moved into mental health in 2017 when I joined the mental health focus area at MRC.
Okay.
And we adopted the same strategy.
The one that you had used.
But remember, it was not documented. We were just having someone on the team that is going with us to
these
bridge
sites.
the gap.
Okay.
So it didn't have proper documentation. It's until recently that we started this digitizing project in Butabika that I clearly saw the importance of someone with lived experience.
Coming on board, yeah.
For us, when we collect the data and start analyzing, we are looking at trends and looking at how numbers are going. But when someone gives you the story, you can relate those numbers to the particular story, and make a very, very good report as opposed to a report with only numbers.
Okay.
So a person with lived experience gives a story to the numbers.
To the numbers that you see on your computer.
Yeah.
So Rita gives us puts it into context. That's what I'm.
Context
the human
of the data or the numbers that you have collected.
Okay, usually
and
human context.
And
that's
you know,
a very good thing.
to the communities also, because much of the work we do is for the communities. Much of the research we do is supposed to impact policy. It's not for publishing papers mainly.
So at the beginning, when you were writing this project of digitizing psychosis in Africa, was Rita with you at the beginning?
Truth is, the information was a bit scanty. Part of the funding recommendation was to have someone with lived experience. But on ground, we were not sure how we're going to involve them.
Okay.
And it's until we started having the project kick off that we realized how much we needed someone. And thankfully, got someone who has a law background that was helping us with the documentation.
Okay.
And people signing, what are those called?
Confidentiality
forms and what.
Yeah.
So she was there from the start all the way up to now. And even going forward that we're going to get the data and start analyzing it. We have a strategy on how we are going to involve her. I think that will come.
Okay. So what I'm understanding is that at the beginning, which usually happens all the time, right? At the beginning, you sat somewhere, wrote the proposal, right? One of the team members that you needed on your team is a person with lived experience. But then you did not have, there was no protocol to follow of that. If you have someone with a lived experience, they are take on tasks, okay?
No.
You realize this is something fairly new in research, and most of us are learning on job.
Okay.
But I think we've learned really well.
We are learning very well, because I didn't think that I would be here on the podcast talking about these things, right? But I think I find a lot of insight in what we are trying to do, in trying to understand that, listen, it's no longer okay for us to sit back, write a proposal, and then remember, oh, Rita is somewhere. Let's bring Rita on board because she has a lived experience, and because the fund again says Rita should have,
so
should be or should be. It's more like ticking on the box.
Like tokenism.
Yeah. And what we are trying to talk about in this podcast is that we want Rita to be from the beginning, isn't it?
Yeah.
That we sit with Rita and say, hey, Rita, by the way, I'm thinking maybe this project, and then we write together, right?
Yeah.
Isn't it what we are saying, Rita?
All researchers out there look for Rita.
Now it's our karango. You're now advertising yourself. You're now advertising yourself.
Yes.
Really? You're advertising yourself?
But no. It was a joke. But I think seriously, having to hear their voice from the beginning is really, really very important.
I agree.
Because they might bring a context that you do not or might have missed. They might even have the answer to the research question that
the truth is that we are not the epitome of knowledge.
Yeah,
we are not,
that you've been searching for a long time. I had a story where a colleague shared that they had been trying to make this research question for a while and why people don't go back for treatment. And this guy just came and shared this story in 5 minutes. They had gotten all the answers to the research problem.
Okay. Yeah. So then that brings me to the other part of the conversation of how do you think your experience with mental illness, right, has shaped so far this project? Given that this is again, you said is a new project where we are trying out things, right? So 5 years, Rita, how do you find that your experience with your experience with mental illness, you living with mental illness, has shaped this project?
So yes, yes, there is me living with a mental illness, but also I believe with this specific project I've brought more to the table, even just with my skilling. Like he said, when it came to the legal part of it, when we wanted to put up the scanning document area, we didn't have contracts. And then I stopped and I was like, Wilber, where are the contracts?
You needed contracts as a person who has a lived experience?
No.
No, she's coming in
So-
as someone with a legal background.
I'm
Okay.
coming in
So
as
it's a package.
It's
that she
a
comes
package.
with.
Of course.
Yes.
Because we usually
That's
think that
the
maybe
thing.
people who have lived
People-
experience don't have also
have-
these
Yeah.
other
Yes.
skills, right?
And that's the point
Yes.
I'm trying to make.
Yeah.
People with lived experience
Yes.
are more than their mental illness, and
I
they
agree.
have other skills they bring to the table. So when you ask the things I've brought in this research project, one, I brought my legal experience. Two,
Power to the people.
my communication skills, but also there are some things that a textbook can't fully explain, even though
Totally.
you've studied and read everything. Mental illness is not a one size fits all. So they might have statistics that 1 out of 3 people respond to this differently. But then what happens
not
to
true.
me, who is maybe the 4th or the
Yeah.
5th, and I'm like, hey, my hand is here.
And your story
Okay.
could be
And
different.
yeah, and my story could be different.
Different, yes.
Yeah, so we bring that to the table, but we also help bridge the gap, like he said.
Yeah.
It's very easy for me to, if we are doing a research outreach and stuff like that, it's very easy for me to go on my social media pages and say, hey, guys, we are hosting a support group. Researchers will be there. Come through. As opposed to if Wilber does it,
Yeah.
Okay.
the feedback will be different.
You guys
because-
always have too many followers on your
no,
social
because
media platforms.
I have built trust with them through sharing my story, through sharing my healing journey. So they will be more willing to listen to me
what you have to
Than
say.
someone
than
new.
a statistician who has come with his laptop and computer and they just want the data.
Okay.
Yeah.
That's-
But we also bring the personal effect to it, the human effect to it. We went for a workshop and the first day they were just talking about numbers. I tell you what, I did not understand anything that day.
And I think that happens a lot of the time, and that is why HEKIMA Podcast is trying to break down mental health research so that the person who will listen or the person who will watch will
Yeah.
understand exactly why
What-
those numbers are.
Yes.
How do we get the numbers?
Exactly.
Yes.
Because the human context is so important. What's the use of this data if I can't understand it?
If you can't relate
If
with
I
it.
cannot relate
It cannot
to
solve
it.
your solution, your
Yeah.
problem, sorry.
And I would also want to take it back to one of the things they taught us in law class, that a good lawyer is the one who is able to interpret the law so that a person can understand it.
A very
So
lay person.
yeah, the layman, the person in the village, you're able to tell them 1 out of 3 people. Then a person comes and says, Kati, you have 3 friends. Now 1 out of those 3
Three friends
friends,
could
yes, could be. So breaking down the data is really helpful because this is our life. This is what we experience every
Yep.
day. We know how the systems have treated us. We
Yeah.
know how the policies are treating us. And we know the gaps that would want to be filled.
Yeah.
Yeah.
For a moment, I think I want to take this opportunity to acknowledge our funders, right? Our funders to Digitizing Psychosis in
Uganda.
in Uganda, the likes of APHRC, Wellcome Trust, the Uganda Society of Health Scientists, the Department of Psychiatry, Makerere University, Butabika Hospital. But we want to also appreciate people like the Rita, and Rita in plural, like people who have lived experiences that have gone on to share the experiences. They make the work a little bit easier, right? We no longer have to imagine things. They make it more easier. And so we can only thank the funders for allowing us to have this flexibility as well.
Yeah.
Well, Previously, they would say, do this, and this is what we would do. But our funders have given us a leverage that we can adjust and work with Rita and the team. And so that brings me to the question of you as Wilber, right?
Yeah.
What does true co-production or true joint research look like between you and Rita, or between you and other people who have lived experiences? What does that true production look like?
I think I'd given a bit of background to this already. And I had mentioned that traditionally, scientists go, they write their proposals, they win their grants. When it comes to implementation, they recruit participants.
Yep.
Then maybe at that point, they involve someone with lived experience. After using them, they discard them. And
Quote unquote.
And continue with dissemination, and their names appear on papers and
conferences.
They are attending conferences.
They're
in
recognized,
different countries.
yes.
They become professors.
Yeah.
But the story needs to change. Because this work we are doing, or the science we are building, is not for the scientists.
Okay.
It's for mainly policy and helping the
Wananchi
wananchi.
in Kabera Maido.
So if we can involve these people and get their stories and get their insights and get their ideas, their opinions right from the start, it's going to help shape probably better proposals, better outcomes, better patient outcomes, like you might know. So right from when we get an application or writing an application, involve someone with lived experience to get their opinion on how their experience is with that particular condition. If it's depression, it could be depression. If it's any psychotic disorder, involve them right from the start. When you win the application, involve them in the planning meetings, involve them in the data collection.
So we have to, what I'm hearing is that we need to have Rita, right? From the beginning. Just like how we started this podcast and said, hey, Rita is around, Wilber is around.
Yeah.
That's how the conversation also with
That's how conversation
true co-production should begin.
Because it's only called co-production if someone is involved right from the start.
Yes.
If it's someone coming in at what particular stage and then they drop off, and many times they're not even acknowledged.
They are never acknowledged. They are never acknowledged.
So,
but I must say that I acknowledged mine in my thesis, right? And I keep telling them. So my research was PTSD among ambulance personnel, right? And I have had to acknowledge them in my book. I hope that I'll get a chance to acknowledge them personally for giving me the information, and I understand it now better, given the opportunity.
And in research, there is something called a transport, or something. It's usually called a refund.
Yeah.
Many times we think
that is enough. We have sorted them, yes.
Yet there is much more.
There is much more.
That should appear on paper.
Rita, have you received that kamani, by the way? Have you ever received that kamani?
Yes. So at the beginning of my advocacy journey,
yes,
I would receive that kamani, but then I realized it would be called for a panel. The doctor says his stuff, the other person says his stuff, but then the story that they're dwelling on is mine.
Is yours, yeah.
And I'm only given transport, and then I go to ask, like, oh, how much are you paid? 1 million. How much are you paid? 2 million.
And you?
And all I got is like 50K to go back home and a meal for the day. Because they don't value it as an actual expertise. They think it's just
on their
stories.
behalf, I want to say I'm sorry. I want to say I'm sorry that you endured that for quite a long time.
Raymond.
No, I'm not a culprit, but I know that this story is as vivid as it can be. It's common. It still happens, and we are not only talking about only in mental health research. Really, you've said you've worked in HIV. I'm sure you must have seen that.
Same story.
I'm just saying I'm sorry to people like Rita, or Rita yourself, that you had to go through that. We didn't know better either.
Yeah.
I call it being used.
And
Being
yeah,
used.
it was actually being used.
Yeah.
And these people are sharing stories that re-traumatize
Yeah.
them, put them back in that
Yeah.
space. And they don't even cater for the aftercare or
Yes.
the after treatment. Okay, give me transport, but pay for my review that I have to
To go for tomorrow,
after
yeah.
tomorrow. Yeah, but none of that is put into consideration.
Yes.
And yeah, now I know better.
You do.
And yeah, I have a red card. You want to call me to speak on a podcast? You want me to call me? You want to
I'm
call
not
me on
paying
a
you
panel?
today. We are not paying you today, by the way.
You're using me.
We are not paying you today.
You want to call me on a panel? I will give you my red card.
But you can
And-
advertise
and-
your hat.
Probably Rita has a platform to speak.
Yes.
But many others
And,
don't.
and,
Yeah,
and
many others don't,
And
yeah.
many others don't.
Don't.
Many others haven't reached that realization. Yeah, so I think we need to do better.
We need to do better.
Yeah, especially
Any
when it
challenges
comes to
that we do find in this eco partnership between the patient or the person who has a lived experience and the researcher? Any challenges that we need to point out so that it shouldn't be like it's easy, but we should point it out so that the public also understands that there are those inequalities that usually are forethought.
Yeah.
They are not really there, but they are forethought for some reason. Any challenges that you know, Rita or
I think
Wilber?
one I can quickly think of, I think Rita has spoken about it in some earlier meetings, is if you're to be involved in a research journey,
Yeah.
you need to equip yourself
With skills?
with
Yes.
minimum skills.
With minimum skills. And
So
I think-
sometimes you might want to involve someone, but they cannot even get involved in the very basic of things. Many scientists have an issue of communicating their science.
Yeah.
So training another person who is lay in that field is quite difficult. So it's a two-way thing.
Yeah.
I need to learn to communicate my things to this person, but also they also need to be willing to put in some little effort
Yeah.
to get better at that.
Just to add on that, at first when I was advocating for PLEs to be added into grants and stuff, I was like, these researchers are the bad people. Until I sat down with some PLEs.
we are bad.
Until I
bad.
sat down with some persons with lived experience.
Yes.
And I said to myself, you know what? I would not hire you because not even the minimum skill. If we are saying you're
skills were you
supposed
looking
to be
for?
a bridge between people, at least go do something on communication.
Communication,
You get how are you going to communicate eloquently to the people that you're supposed to reach? But also it comes from a place of we have been taught that our role is to show up our face, and that's our role, and
your
we
story
sign.
And the doctor
We
signs
give a
off.
story, we sign, and we
go
go.
home.
That's
Okay.
our role. But I believe that adequate skilling is very important. What do you bring to the table outside of your story?
I thought this table was only in other areas, but now it has also come in research.
Yeah. What do you bring to the table outside of your story?
Yeah.
I think that's very, very important. And it's something us as person of lived experience need to look into.
So then on that note, as we wind up, right, how do we ensure the diverse voices of people with lived experience are involved? So for you in Kampala, how do we ensure that a person who is in Karamoja or in Moroto or in Gulu, right, is involved in this conversation or is involved in this research?
At some point, you have to go on the ground, like he said, when they were doing the HIV study, they went to the villages.
Yes.
You need to go there. Something I realized today as I was reading up is some of these stories are now very digitalized. So the experiences that we have of people with lived experience are people in Kampala who can sign up a document and
Yeah.
share their story, or people who have access to social media.
But people have
But-
TikTok now.
But
Can't they just go on their TikTok and just say, hey, Nze ndi mulwadde,
does
you know,
everybody have TikTok, even the people in the villages?
Maybe not.
Aren't we cutting them out? Is then our research a well-balanced research.
That's why I'm
Are
asking.
we only doing it for the middle class and the upper class? So I believe you have to go to where the people are
yes.
and collect those stories too. Yeah.
And probably get to that level.
And get to that level.
Be the wananchi as
Be the
well.
wananchi.
Yes.
Okay.
Don't come.
Speak their language. Don't
Sit
go
with
with
them
your
on the
complicated
mat.
English.
Yeah.
Sitting on a mat, you sit on
Sit
a
on the
You sit
mat.
on a mat.
They will
You
get
don't.
engaged.
You don't order for a chair.
And also, you
for
tell
to
them.
the mat.
You also tell them that I want to know your story, and this story I want to share with the. You give me the permission to do that, okay?
Yes.
And I know that Wilber, in the coming weeks, you will probably take us through the basics, right? The basics that you want our people, the public to have in research, so that they can be involved earlier on, because you did mention that we lack these skills. They lack the skills, right? And so Wilber will, in the coming weeks, try to take us through those.
The research journey, right from the start to when it's completed. But
When it's
giving just
completed.
the basics.
The basics, we just
Enough
want the
for
basics.
lay
No
person.
complicated language, no
Exactly.
complicated scientific terms, just that. And so that brings me to probably maybe the last parting shots. In regards to co-production, right? Having people with lived experiences and research, especially mental health research, because we know it's the most maybe
Funded.
and not underfunded, but understood, right?
But also, and it's
we must
very stigmatized.
Very stigmatized, a lot of discrimination. There's a lot
a
of
very
spirituality in
sensitive area.
it. Yes,
It's still sensitive.
it's still sensitive.
raw.
We acknowledge that. We acknowledge the sensitivity of it, but we want to see how do we work with that sensitivity to include everyone into that sensitivity, because it looks like maybe the researchers are the ones interested in the sensitivity. Yet we need everyone on board.
You know, a problem is only a problem when it's with you. If you've never experienced something, many times you don't find how important it is.
Until
Okay.
the
Until it
elephant
comes home.
is in
Until it is in your
your
homestead.
sitting room.
So it's better you prepare for something, because in life, really, there
Yeah.
are many stressors, there are many triggers to mental illness.
Yes.
And I think the kind of life we're living is quite exposed to those. So we just need to be on guard and be ready. And
I think it's really important, because it's just the basic. If you have a brain, unless you don't have one, I'm not talking to you. If you have a brain, you can be disposed to having a mental illness. Your brain is like any other part of the body that can fall sick.
Yeah.
So just the way we take care, good physical care of our body, is the same way you should take care of your brain. And don't wait for it to be on the other side. Just like you have a full body yearly checkup, go see a psychiatrist and do a checkup. You don't have to wait to be ill to do this. You can do this when you are a normal human being, a normal, healthy human being who's not on the other side of the spectrum.
Thank you, Rita, and thank you, Wilber. For me, I think my parting shot would be that you share this podcast with all your loved ones. share on YouTube.
Even their enemies.
Even with your enemies, please share. And the other thing is that we need to thank our funders who have made this possible, right?
Yeah.
APHRC has done an incredible job. It is helping us with coming up with scripts, and but most especially to make this possible with being here. Welcome Trust gave us the money. Uganda Society of Health Scientists, a big society, has been able to house us in terms of holding our monies, but also giving us technical and administrative management. We have the Department of Psychiatry that at Makerere University that has housed me, has housed Wilber, is housing Rita, in terms of what can we do better, in terms of coming up with ideas and being as innovative as possible. We want to also acknowledge people with lived experiences that have taken a step forward to talk about their experiences. For me, that's really enough. You've helped me and Wilber and Rita. I know Rita has her experience, but the moment she also listens to other people's experiences, she learns, but also maybe she understands her experience even more deeply. and me and Wilber just coming in to understand of like, oh, when you say this is what you mean. Okay, when you say that you don't feel like the medication, it's because maybe the medication is really not giving.
And the side effects.
The side effects. So the side effects are too much. It helps us not rub it off and say like, oh,
You're
Jacoba
just
Burundi, you
lazy.
get better, or you're lazy. It helps us to listen to you, and we encourage you that every time you walk into our facilities, okay? Yeah. So we have Makerere University Hospital, where we have the early intervention psychiatry. When you walk in, do not be comfortable with only the doctor speaking, but also ask the question and tell them your experiences.
Street.
Yeah, tell us your experiences. And so we want to continue that conversation. The avenues where they can come in and actually participate. So we have, of course, at Makerere University Hospital, we have that, right? Yeah. We'll also be sharing more avenues. So far, that's where we know we can get your data, your information, your experiences. But also when you go to these other hospitals where you get psychiatric services or psychology services, we have heart-to-heart spaces where you provide free
support group sessions every
free
month.
Support group sessions every month. Do you have a specific day?
No.
It's every month. Just know it's every month.
It's every month. They just have to look out on
and you don't have to have a
pages.
mental illness, right? You can be psychologically distressed.
Yes.
You can be financially challenged. All that, right? We can come
stressed.
and stress. Or even stress. Yeah.
Just stress.
Yeah.
You can come.
And have those sessions. Are they free?
Yes, they're totally free.
They are very free.
Spaces.
And they are very free. So take some time. We also want to acknowledge our media team, the Penda agency, which is usually like behind the camera.
MVPs.
Yeah, so we want to also acknowledge Dr. Mwesiga Emmanuel, our PI, right? You saw him in the first podcast, but he's been the gentleman behind steering this
everything.
whole team, steering our thought process to think about why we need Rita always on the podcast, and I forgot to say that actually you look lovely.
Thank you.
But with no makeup. Okay, today there was no makeup. But again, we hope to again see you very soon. But please share, subscribe. We are on YouTube as HEKIMA Podcast. We are on X as HEKIMA Podcast. We are on Instagram, LinkedIn as HEKIMA.
LinkedIn.
I know I come from Kashari, so you will forgive me. Yeah, but again, we hope to again see you, Wilber, Rita.
Thank you.
It's been really good to share information with the public. Yeah. So mental health research for the public is what we are up for. And HEKIMA Podcast.
Oh, yeah.
Oh, yeah.